It's a nice cold, rainy morning, so a good time to be in front of the computer and watching a presentation. I'm going to be updating my talk that I gave in 2021, which was about surface ear surgery and the new techniques we were using in order to make things easier for the patients. So what I thought I'd do today is, so as not to repeat myself unduly, is we will talk a little bit about how surfing started becoming popular in South Africa and what effect that's had on Cape Townians, particularly surfers and their ears. And then we'll talk a little bit briefly about the surgery itself, and then I'll give some of my results and some personal testaments from people who've had the surgery. So this picture is not from Cape Town. This is Te Aupo, which is in Tahiti. And the reason I'm putting that up is because I looked online yesterday and I looked up the water temperature in Tahiti, and it's 27.5 degrees yesterday. So that's basically like being in a warm bath. And for surfers, that's amazing because you can surf in your board shorts. And the other reason why I'm putting up this picture is because Te Aupo is going to be the venue for the Olympics surfing competition later this year. Obviously, it's not in France like the rest of the Olympics, but it is a French territory. So our own Geordie Smith is hoping to make the Olympic team. Last time he had a knee injury and couldn't compete. So let's hope he does well. There's another picture of the wave, and what you can see here, apart from the warm water, is how thick and slabby this wave is that's about to land. More closer to home, this is a picture at Long Beach, Komiki, which is where a lot of my patients come from. I thought I'd put up a big picture of the wave that sometimes happens at Dungeons just offshore from Hout Bay. Now, bear in mind, the water temperature here is very different to Tahiti. Another picture of a very popular surf spot in Cape Town at the outer at Komiki. The water temperature, generally speaking, I've got a slide later on, which I'll point out. So this is a picture, the first picture of anybody surfing in Cape Town. It was at Muizenberg in 1919, and you might say this is the start of surfing in Cape Town. And it was a woman, Heather Price, who was actually a Rhodesian at the time, but Zimbabwean woman. Another picture showing how surf culture started becoming popular. This is in the 1960s at the Bay of Plenty in Durban. Again, warm water, so that becomes relevant for surfers' ear because you don't get surfers' ear in warm water, so people in Durban don't really get it. But I'm putting up the picture to give an illustration of how surfing culture became popular. The Endless Summer was a movie set in St. Francis Bay and showed the surf culture in the 1960s. I recommend a view of it if you're interested. Now we're getting to the 1970s, and these two pictures are of Sean Thompson, a South African from Durban, who went to Hawaii in 1975 with a few Australians, and this is now the subject of a documentary called Busting Down the Door, because they really started popularizing surfing as a contest. And surf contests really kicked off in a big way when they showed their prowess in the 70s in Hawaii. And surf culture has become really mainstream in the years subsequent, and I'm sure you can recognize some of these brands. They're now, seen in the street everywhere. People wear surf clothing without realizing that they are actually wearing surfing brands sometimes. But it's really become popular and mainstream, and surfing in South Africa, particularly, and in Cape Town as well, has really exploded in popularity. The older surfers from the 1980s and 1990s, their kids are surfing now. Places like Muizenberg is overcrowded. Here I am showing some of my surf prowess. I think I overestimated or underestimated rather the beach break at Robberg Beach that day, so that was the outcome. And to get into the mood for this presentation, I had a little gap yesterday afternoon, and I went to Muizenberg and I caught a few waves. I'm not a very good surfer, but I enjoy it, and that just illustrates the thing that is happening is that people who are not necessarily dedicated surfers can get in the water now, and places like Muizenberg can spend some time and enjoy themselves. So here was the slide showing the water temperature in Cape Town. So the minimum water temperatures even in summertime are under 17 degrees. And in winter, when the best surfing weather is and the best waves and conditions for surfing, sort of between April and September, are down to about 15, 14 degrees. And what happens also is that with modern wetsuits, people can spend far longer in the water than they used to be able to. So, a surf session of 3 or 4 hours is quite common in dedicated surfers. And what happens is with repeated cold water exposure and cold water rinsing through the ear canals, every time you duck under a wave or get wiped out, you get icy cold water flushing through into your ear canals. And the ear canal is the only place in the body where you get skin directly growing on bone with no subcutaneous tissue in between. And for some reason, that cold and warm alternating cycle of flushing cold water and then warming up again with blood supply stimulates osteoblasts in the ear, and you get bone growth into the ear canal. So I've got 2 examples here of sort of moderately severe exostosis growth into the ear canals. We can see far worse, and many people growing up in Cape Town, even if you haven't surfed, if you've done a bit of swimming in the sea, as in childhood or later on, will have some small degree of surface ear exostosis. And it's only really when it gets really, really narrow that you start getting problems. So here's another illustration of where the bone growth occurs. Normally it's 3 buds of bone that grow inwards. So surface ear is an abnormal ear canal bone growth, obviously, because of cold water exposure, as I've explained. So you see it in surfers, sometimes in divers, and of course there are other water sports now which have become popular: windsurfing, kiteboarding, wing foiling, and they get it to a slightly lesser extent because you spend more time above the water than surfers do. And divers actually don't seem to get it as much as one might expect, and that's usually because in cold water they're generally wearing hoods, and so keeping their ears warm in that way. So it's progressive if you continue to engage in cold water sport. And interestingly, one side is usually worse, and it depends where you like to surf, usually probably due to the prevailing wind as you're facing out to sea. So what tends to happen is you get your surface ear bone growth. It's pretty asymptomatic as it gets narrower and narrower until around about the age of 40 odd. You start getting problems with trapping of water, infections, blocked ears, and then if it gets really bad, you can get hearing loss with the blockage or even with complete closure of the ear canal with bone. So most surfers, when they start having a problem with these things, they start wearing earplugs, which is a bit late. If they had been wearing earplugs earlier, they probably would have prevented a lot of these things. And they start taking water precautions. They start staying out of the water, being careful with swimming. They start wearing hoodies. You can use alcohol eardrops to dry the ear out if water gets stuck in the ear. You can see your ENT and get the ear suctioned, and eventually it really becomes annoying and it starts causing regular infections and you might need surgery. So for a long time, surfers viewed the surgery with great trepidation. I think with good reason. The sort of I would call it old school. It might be a bit insulting to people who still do it this way, but the typical way of doing it was with a post-auricular incision, and then lifting up the skin and drilling down these exostosis with a high-speed electric burr. You might need to put in skin grafts because you've lost some of the skin coverage of the ear canal. So the healing is slow, and there's a long delay until patients can return to what they love doing, in this case, surfing. There are, in that method of doing it, the risks of infection, of damaging the hearing with the high-intensity noise, or touching the eardrum with the drill and causing hearing loss in that way, and subsequently getting long-term or permanent tinnitus or perforation of the eardrum. So here's an example. I looked for the most egregious example of a post-auricular incision. Looks like they've stitched up with silk stitches, so it looks pretty ugly. And this really is very scary for surfers. So what I would call the new method, and what I do, is to do a permeatal approach. And by that, I mean we use the ear canal, so keyhole surgery without making an external incision. And I use 1 millimeter osteotomes, set at different angles for chipping down or sculpting down the bone. It spares the skin because you split the skin and move it to the side, and you spare it so you can place it back over the exposed bone later. Generally, most patients can be back in water sport after 2 weeks, and there's a very low risk of infection because you're not using a drill and there's no high intensity noise. You're not getting as much of a risk of hearing loss or tinnitus. I wouldn't say that the risk is zero, but it's certainly very close to it. So just an example of my osteotomes. They're beveled. You can turn them around to carve and sculpt in different directions, so they're very accurate. It's not like you're using a big chisel and a 10-pound hammer, but this is all done under a microscope, and it's very precise. So this is a real surgery that I did recently to show the severity of the exostosis. You can see a little bit of perhaps some waxy dead skin debris in between the bones. So the way I do it is I make an incision longitudinally along the exostosis to expose the bone. I split the skin and move it side to side to get it out the way. And then you expose the bony exostosis. And in this case, here's the chisel. It's a bit difficult to see, but I'm starting to chisel away the bone in a sculpting technique. And once that is done, you can then move on to the next exostosis and expose that one and proceed in the same way until the whole eardrum is visible and you've opened up the ear canal back to the way it was before. I then line the canal with thin silicone sheets so as to hold the skin gently back against the exposed bone, and I pack the ear canal with some Spangistan gelatine sponge impregnated with antibiotic. So there's some of the bone chips that I've taken out. So my own personal experience was that I came to this chisel method in about 2010. I'd been using the old-fashioned approach, although without making an external, a big posterior excision. I used to make a small incision superiorly. And I found then that when I started using the chisel, I was using the drill in addition to that to polish the end result. And I started using the drill less and less until eventually it stayed packed away. And from 2017 until present day, I've only been using this permeatal chisel method. So my results so far is that I've done in that time period 421 ears in 280 patients. Obviously, some patients have bilateral simultaneous operations, so those are counted as numbers of ears rather than numbers of patients. And I've done 141 bilateral simultaneous patients. It's important to state that it was very much recommended not to do bilateral simultaneous ear canal surgeries when you were drilling, because you were using a high intensity noise in both ears, and the noise travels through the skull bone to both inner ears. So there was a significantly higher risk of causing noise-induced hearing loss due to the time period when you had to do both ear canals. And a bilateral simultaneous drill method might take you 3 hours or more. With the permeatal method, I generally take about 1 hour per ear. Up to date, I've done 10 females out of the 280 patients and 5 doctors, of which I'm happy to say one was an ENT colleague who trusted me enough to operate on their ear. I'm hesitating a little bit to give these results because it hasn't been rigorously scientifically tested. I haven't gone back and contacted all my patients and audited this properly, but I've relied on sort of self-reporting or patients coming back with problems. So, this was not something that you would put into a scientific paper, but it certainly gives us an idea. There haven't been, to my knowledge, any residual perforations. One does get the occasional little puncture or perforation when you taking out small bits of bone close to the eardrum, but all of the ones that I'm aware of that I did, of which probably there were 10 or 12, they've all healed by the time I've taken out their packing after about 5 or 6 days. And I haven't had any patients complain of permanent tinnitus. Obviously, you get a little bit of tinnitus with the packing in the ear canal, which is blocking the hearing. And I haven't had any patients complain of significant hearing loss, certainly none that have been shown on any audiograms done post-operatively. I don't routinely do post-operative audiograms. I do pre-operative just to screen patients, but I would only do a post-operative audiogram if there was a problem or if they were worried about their hearing. So the typical post-op experience is that patients have minimal pain. They usually have 2 post-op visits, one where their packs are removed after 5 to 7 days, and they get antibiotic drops to take for another week, and then I check the ear at about 2 weeks post-op, and I suction out any remaining crusts or scabs or old blood, and then I'm happy for them to return to water sport, although I recommend that they wear earplugs. I've got some testimonials from patients. I contacted some of my people that I have contact with and asked them for their experience. Some of them have had the previous surgery as well with the drilling and have had to have a second operation with a chisel. Generally speaking, you can read those testimonials there that people are very happy. Surfers are happy that they don't have a lot of pain, that they heal quite quickly, that they don't have the need to wait for 6 weeks for skin grafts to heal. They can get back to water sport in around about 2 weeks. And most people I ask say, well, they'd be happy to have the procedure again. Ideally, we'd like to prevent that from happening. I asked one guy what his experience was, having had the previous drill surgery done 20 years before, and then my chisel surgery recently, and he said there was just really no comparison. So I'm going to finish the talk. I've been quite efficient with time. I see we've still got 10 minutes left before 8 o'clock, but I wanted to finish the talk by saying that you can prevent this surface ear problem by wearing earplugs and preferably a hoodie as well. And I think this is pertinent because, as I was saying, we're getting a lot of young teenagers, from the age of 11 or 12 starting to surf now, often kids of parents who surf or kids who live in the area. And there's not a lot of awareness of prevention of the problem with surface ear. So I think what we're trying to get the message through is that if we get these kids to wear earplugs and a hoodie, hoodies are not cool, but at least wearing earplugs from when they start surfing, we might not see the same problems when they reach their 30s or 40s. And of course, a problem that happens sort of 20 or 30 years hence is very much out of one's mind. And I'm trying to spread the message for prevention, even though it might be to my own detriment. But I don't think we've got a shortage of patients with surface ear. And I'm sure the numbers that I've seen up to now are going to increase and continue as the word spreads amongst surfing WhatsApp groups and surfing communities that this type of surgery is now very much easier and really is a minor procedure compared to the old school method. Right, I think that's it from me. So I'm happy to take any questions. I see I've got on the messages here, Keith Cronwright has said, you did my ears pre-2017. So I think in that stage, I might have used the chisel and then just drilled a little bit at the end to polish up the ear canal. And he said his ears are still good 20 years later. So well, that's good news.